I'm Dr. Chris Driscoll with Omaha Integrated Health, and today I wanted to talk to you about hyaluronic acid knee injections for knee pain relief and joint therapy. So the knee is probably one of the most commonly injured joints of the body. There are literally millions of people who have suffered from knee pain, chronic knee pain, and reduced mobility in their knees, especially in their senior years after suffering from several traumas to the joints over the years. Whether it's micro traumas or major traumas, doesn't really matter. Those traumas add up. And as the years go by and the traumas accumulate in the joints, the knees can start to degenerate and develop osteoarthritis. And probably one of the best treatments out there for this is hyaluronic acid knee injection. So what is a hyaluronic acid knee injection? Well, hyaluronic acid knee injections, or HA injections if we want to do it for short, are rapidly becoming one of the most popular treatments for the knee. They're extremely safe, and they're an effective treatment for chronic knee pain, limited motion, and joint degeneration. Why? Because hyaluronic acid is a naturally occurring substance that's already found in the body. It helps lubricate and cushion the joints. When it's injected directly into the knee, it provides an extra cushion and an extra lubricant. And it serves as an extremely effective shock absorber, kind of like a sponge in between the joints, that can help not only reduce the pain, but increase your range of motion as well. It can also improve mobility and increase your function, and may even help prevent or postpone surgery. And we want to push that as far down the road as we possibly can. You never really want to have surgery unless you absolutely have to. So hyaluronic acid is very effective for osteoarthritis in the knee. They're not just good for pain, they're actually good for the arthritis itself. Now, it cannot take away bone spurs, and it's not going to give you back cartilage. But what it can do is make it function the way that it was functioning prior to a lot of those injuries. So if you have osteoarthritis of the knee, you may find that injecting the hyaluronic acid is one of the most helpful and natural treatments that you can get out there. Osteoarthritis, or also called just arthritis, is a condition that causes the cartilage in the bones that make up your joints to decay. It starts to wear down. This can lead to pain and stiffness in the joint, and it limits your range of motion. Sometimes you can't even bend your knee completely the way that you used to. So hyaluronic acid injections, they can help reduce those symptoms and improve your quality of life. And it's been shown to be a very effective in mild, moderate, and even severe arthritis. There's a lot of studies on hyaluronic acid that show that the participants that actually received the hyaluronic acid injections reported a significant improvement in knee function compared to people that just received a placebo injection. So we do have studies to back this up, and they've been out for quite some time. The hyaluronic acid injections are also good for meniscal tears. So that's another reason you might want to get hyaluronic acid injections, just to help for the tears in the meniscus. Now, if they're completely ripped apart and they're damaged to no end, you might end up having to have a scope. But we like to prevent that as well. Even a scope in the knee can be dangerous, and we just don't want to do any kind of surgery. We want to do anything invasive. We always want to start with the least invasive and work our way up to what we have to do later down the road. So there's a lot of studies out there that show the same thing, that hyaluronic acid injections for the knees can help with the tears in the meniscus. Now, there's a lot of studies that also show that HA injections are effective treatment for these tears, and basically what this meniscus is a piece of cartilage that separates the femur from the tibia, the upper leg bone from the calf bone. Basically, it helps cushion the knee joint and helps keep the bones from rubbing and grinding together. And a tear in the meniscus can have a lot of pain and a lot of swelling. Hyaluronic acid injections can serve as both a lubricant and additional cushion for that meniscus that serves to further separate the bones, and can make up the joint and relieve the pressure being placed on them, even with just normal weight bearing and movement, and can take some of the pressure off of that meniscus. Now, there are different types of hyaluronic acid. There's basically two types of hyaluronic acid available. Each one of them has its own benefits and its own drawbacks. The type we prefer to use, the type we always try to use, is going to be what's called Genvisc. And the reason why we use that is because it is the one that most closely matches with the natural occurring hyaluronic acid that's already in the body. The other type of hyaluronic acid is an artificial hyaluronic acid, and it is derived from avian or bird products. It's also known as the chicken shot or the rooster shot because it is sourced from the rooster comb. Now, we can use artificial products, but we prefer to use the natural hyaluronic acid as it seems to last longer and it has a lower risk of having side effects, especially if you have allergies to bird and bird products. Genvisc is delivered directly into the joint in a series of injections, and it can provide long-lasting relief from both knee pain and it can last for months or even years, but also can help you increase your range of motion as well. So one of the questions that patients ask when they come in, right when they start, is how long does the hyaluronic acid treatment take to work? Well, HA injections for the knee usually provide relief fairly quickly, but it could take several weeks depending on how much damage is in the joint, how long the arthritis has been present in the affected joint, how many traumas the joint's been subject to. Genetics play a role in this, weight, age, everything kind of adds up. They each play a little bit of a role in how long your treatment will last, how well you take care of yourself, or if you don't take care of yourself, and what you eat and all that. There's a number of things that can be involved in that, but in general, it does pretty good. Sometimes the best results are actually seen after a second round of injections has been delivered if a lot of damage is present to the joint. I mean, if you're just sucking bone on bone, sometimes you'll need a series of this. Each patient's different though, so it's important to follow the recommendations given by that will give you in your care plan to get you the most benefit. So just to kind of summarize this, hyaluronic acids provide a great deal of benefits. They can reduce the pain and inflammation. They enhance your joint function. They promote cartilage healing. They reduce joint stress. They increase the joint space in between the bones. They can slow down the progression of osteoarthritis, and they can help postpone or even eliminate the need for surgery. And they can last several years. So what about side effects? What are the side effects of hyaluronic acid? Well, look, when it's performed by a qualified medical professional, hyaluronic acid knee injections are relatively safe. However, as with any medical procedure, there are some potential side effects that can occur. Now, on these, they're relatively mild, but some of the things that can occur are slight tenderness or swelling at the injection site, a rash, redness, bruising, if you're going to get anything at all. So let's go through a couple questions that a lot of the patients tend to ask. So what happens during a hyaluronic acid injection? How does this process work? Well, when you come to the office, we'll usually go through your health history and discuss your specific issues and needs. And then if you are accepted into care, we'll schedule a thorough exam of the knee and x-rays to the joint if that's necessary. And once it's determined that you are indeed a good candidate for care, you can start treatment. But during treatment, hyaluronic acid is injected into the tissue. It's pretty quick, it's pretty easy. That will create an extra layer of lubrication. After the injection, you can go about most of your usual daily activities as long as they're not too strenuous on the knees. I mean, this isn't the time to rent a moving truck and test the limits of your knee. But the entire treatment can usually be done in about 30 minutes or less. In fact, we've had patients that come in over the lunch break and then they get back to their office in less than an hour. So it's pretty easy, uneventful treatment. There's really not a whole lot to it, but it's very, very effective. So then another question that people ask is, how long is this going to last? How long can I expect this to work? Again, that's another hard question to ask because everybody's so different, but how much relief and how long that relief is going to last is going to be determined by several factors, like how many injuries you've had in the past to the joint, how healthy you are in general, whether you've had underlying conditions like diabetes or lupus or MS, or if you drink a lot of alcohol, if you smoke, cardiovascular disease, your age, how compliant you are with the care, genetics. So there's a number of things that can affect this, but most of the patients are going to experience relief after just a few injections, and the relief typically is going to last several months or even years. Now, people sometimes will go, well, several months, that doesn't sound very long, but look, if you've got bone grinding against bone, we're going to put as much cushion as we can in there, but there's not a whole lot else that we can do. What our goal there is just to prevent surgery, keep you out of that operation room. So, is this covered by insurance? That's another frequently asked question that we get. Hyaluronic acid injections are covered by most insurance plans, including Medicare and some Medicaid. So just be sure to bring your insurance card to see if your specific plan covers this. Also, the best thing to do is just call the office. We're at 402-816-2738. Had to think there for a second. And set up a free consultation with me. If you do have any x-rays or MRIs, or at least the reports, if you got the reports, bring them with you and we'll take it from there. Until then, thanks for watching. I'm looking forward to seeing you in the office, and let's take care of those knees.